Why is my vision still blurry after cataract surgery? Hi, I'm Mira, Dr. Neil's assistant at Anaheim Eye Institute, and this is perhaps one of the most common questions patients will ask after undergoing cataract surgery. And the reason why it is important for us to discuss this is because it highlights fundamental misconceptions about how the eye works and what actually occurs in cataract surgery. Most patients who come see us for this problem usually say something like, "My friend had cataract surgery and her vision is great. Why did I not get the same results?" There are three main reasons why your vision may still be not as clear as you like after cataract or lens replacement surgery. These include 1. Residual refractive error, 2. Disease in other portions of your eye, and 3. Surgical complications, which may have occurred during your surgery. We will address each of these issues one at a time. Residual refractive error is the most common reason for blurred vision after cataract or lens replacement surgery. Remember that in cataract surgery, the natural lens of the eye is removed and replaced by a synthetic lens, while all synthetic lenses have a prescription power to them. The prescription of the lens that is placed in your eye is determined by the preoperative measurements of your eye. If the prescription of the lens placed inside of your eye does not match the actual prescription of your eye due to inaccurate preoperative measurements or changes in postoperative healing, there will be some nearsightedness, farsightedness, or astigmatism present. These refractive errors will cause your vision to be suboptimal. Also remember that there are many different types of synthetic lenses. Some do not treat astigmatism, some only see at one distance, some cannot be adjusted after surgery. All of these will result in what patients will note as blur. The good news is residual refractive error can often be treated with laser vision correction to fix the problem and help you see better. The second reason is that the eye has many different parts, and every one of them has to work properly for you to see your best. The cornea must be clear. The tear film must be smooth, not allowing any dry spots to appear. The retina and the macula must be healthy, and the optic nerve must send a strong signal to your brain. If any one of these parts isn't functioning normally, your vision may still be limited, even though your cataract surgery was successful. So patients will often ask, "Doctor, why don't I see perfectly? I thought cataract surgery was supposed to fix my vision." Cataract surgery replaces only one part of your eye. We like to compare the eye to a car. Imagine your car has a windshield that has become cloudy over the years. You replace it with a brand new crystal clear windshield. You'll certainly see through the windshield much better, but what if the tires are worn out? What if the brakes don't work well? Or what if the engine isn't running properly? Even though the windshield is perfect, the car still won't perform the way you want it to. Your eye works the same way. During cataract surgery, we remove the cloudy natural lens and replace it with a beautiful, clear artificial lens. That's an important step toward better vision, but only one piece of the puzzle. Therefore, it is important to have a comprehensive evaluation of the eye, both before and after lens replacement, to help identify and treat any other parts of the eye that may not be working properly. There's one more reason why vision may not be as good as expected after cataract surgery. Unfortunately, it's uncommon. Like any surgical procedure, cataract surgery carries the risks of complications. The biggest risk happens when the patient has waited too long and has delayed surgery. The average age for cataract surgery in the United States is 68 years old. Every day the cataract grows, and the bigger it gets, the more complicated the surgery becomes. To remove a cataract, you have to understand that it cannot be removed whole. Every cataract is cut into pieces, and each piece is melted by ultrasound energy. The bigger the cataract removal, the more cutting is involved inside of the eye, and more ultrasound energy needs to be used to melt those pieces. This greatly increases risks of surgery. As the cataract continues to grow, it often becomes larger, denser, and much harder to remove. Instead of having the consistency of a soft grape, it can become as hard as a small rock. Removing these very dense cataracts requires more energy and can place additional stress on the delicate structures inside the eye. Some patients also have other conditions that increase surgical complexity, such as weak support fibers that hold the lens in place, prior eye injuries, previous eye surgery, very small pupils, or other eye diseases. Although serious complications are uncommon, they can affect the final visual outcome. This is one of the reasons we encourage patients not to wait until their vision has become severely impaired before considering cataract surgery. In many cases, operating earlier allows the procedure to be safer, more predictable, and gives us the best opportunity to achieve an excellent visual result. The good news is that modern cataract surgery is one of the safest and most successful operations performed today. With careful planning, advanced technology, and an experienced surgeon, the vast majority of patients achieve outstanding vision.